And is it physically possible, given that Mr. Sibal has suggested that it should be done not by technology but by humans, by teams going through all that content? That debate also continues, but let's just move to something else completely different, and that of course is on surrogacy going mainstream when one of India's top superstars, Aamir Khan, and Kiran Rao, his wife, announced the birth of their baby boy via a surrogate mother. Let's just look at that story.
So far, surrogacy was done behind the closed doors. But now, after Mr. Aamir Khan's, probably many people will openly accept.
For Dr. Indira Hinduja, Aamir Khan is the new mascot to promote surrogacy in India. The Bollywood superstar and his wife Kiran's decision to go public with the birth of their son through surrogacy, doctors believe, will bring in much needed public acceptance. Acceptance that's been missing, especially amongst Indian couples, who unlike foreigners have been squeamish to even openly discuss the issue.
I decided to do it in India because I think that the best place to do it, more than to do it in Thailand.
Israeli national Omar Azoulay is a single father. Today he has children thanks to IVF and surrogacy. With 80% inquiries coming from abroad, India has become a leading destination for childless couples.
That once you go to Surrogacy India, you have all the services from the point A of the thought that you want to do surrogacy till the point that you want to take the child safely back.
In India, about 25,000 children are born through in vitro fertilization or the IVF technique. Between 1 to 2% use surrogate mothers. That's about 300 children. For middle class India, the costs, however, still prohibitive, with the procedure costing anywhere between 6 to 10 lakh rupees.
मी घेतलंय, माझ्या थोडी परिस्थिती कंडिशन माझी थोडी खराब आहे, त्याच्यामुळे मी घेतला.
While surrogacy cases in India are on the rise, especially among foreigners, the lack of a law does leave a grey area. With camera person Shatrughan Singh in Mumbai, Saurabh Gupta, NDTV.
Well, joining me now to discuss that are two of India's best-known IVF doctors. I'm joined by Dr. Rishikesh Pai of the Leelavati Hospital, Mumbai, and Dr. Kamini Rao of the Assisted Conception Center from Bangalore. Thank you both very much for joining me.
Thank you.
Dr. Pai, Dr. Rao, both of you known as really miracle givers to thousands of infertile couples around India and abroad. But let me ask you, Dr. Pai, is this a good thing? Do you think when a Bollywood star says that he has used a surrogate mother, making it more acceptable, is this something that we should look at as a good thing in a country where we see so many children abandoned as well? I mean, I think that's always the moral or ethical debate raised about surrogacy, and it would be nice if you actually cleared up the facts on that. Dr. Pai.
Yeah, actually, Sonia, I would, before I say anything, I would like to tell you exactly what is surrogacy, because a lot of people are not knowing exactly what it is. Normally, in an infertile couple, if we go for IVF, you take the eggs out from the woman and fertilize them with the husband's sperm, and the baby is then, the embryo is put back into her own womb. But in surrogacy, instead of putting the embryo into her womb, we put it into a surrogate womb. That is the difference. And in our country, my estimate is that we are doing about 100,000 IVF cycles every year, and about 1% of these cycles are surrogacy cycles. So the actual incidence is not that big. As far as the acceptance is concerned, I feel that slowly the surrogacy is coming into the mainstream, and definitely Aamir Khan coming out in the open has really helped the movement.
Dr. Rao, the question I raised to you about IVF and now surrogacy. The surrogacy has often been seen as problematic because of the fact that a fee is involved to be paid to the mother who's bearing the child. The whole concept of rent a womb, it's been uncomfortable for many. Of course, when someone like Aamir or Kiran does it, the presumption is that he's an actor who is strong, has taken strong moral stand. It would have been done to the proper route. But the fact is, in that India, there are no surrogacy laws. The question about this whole monetary transaction is uncomfortable for many. What is your view on that?
I think the question of surrogacy is very important, because if a woman is not able to have her own child, why should she not use the help of another person to have her own child? And if you can allow for kidney donation, and that is fine, here you're only getting another person to hold this lady's baby for a short time. And I think this should be considered as altruistic, and because of the time spent by this woman in going through this pregnancy, I think she should be paid something. And I think that is just right. So why should one look at a kidney donor as being very legal and a surrogate person as being very illegal?
Dr. Pai, as a doctor,
And we have the
yes,
ART guidelines coming in. So very soon it would become law.
Dr. Pai, as a doctor who's been at the forefront of using medical technology in fertility treatment, do you find that sometimes in India the science comes first and the issue of the guidelines comes later? We know, for instance, that surrogacy has taken off in India, at least with foreigners often, but the guidelines, the strict laws that are involved are still lagging behind.
Yeah, in fact, I agree with you, but you know, in fact, you know, I have been practicing IVF since 1989, but I didn't practice surrogacy till the guidelines were formulated by ICMR in 2004. The first baby I did was in 2005, and I think the guidelines has really strengthened us, and in fact, for the last 2 years, the guideline has gone to the parliament. We are waiting for the law to be passed, but unfortunately, our ministers and our politicians have not helped us in that area. The law needs to be passed as soon as is possible.
Dr. Rao, I remember a story from Bangalore a few years ago. I don't know if it was from your clinic, but a story which had come out about when IT professionals in Bangalore, where you found many people many young women, career women opting for IVF because it is an easier way to ensure the child, sometimes even opting for surrogacy because they didn't want to take a break from their careers. How do you deal with ethical issues that come up like this?
I think one has to realize that whatever you do in any kind of technology, the possibility of misuse is there. It all depends upon the doctor treating and the patient asking for the treatment, and this is where you need to bring in the regulations and the laws. I think the guidelines are excellent. The ICMR guidelines, this has been started way back in 2002, and it is now seeing the light of day because it's passed through the health department, as the Department of Health as well as the Department of Law. A cabinet note has been issued, and I'm sure in the month of January, February of the 2012, this law would be passed.
Dr. Pai, that I think is a key point also, that the doctor is so important, because we've seen how ultrasounds have been misused by unscrupulous doctors. We heard Dr. Hinduja in our report just make the point that she's happy that there'll be acceptance that Aamir Khan will be the mascot for surrogacy. But are you worried also that you'll have people who think, oh, this is an easy way, that who will not come to you strictly for medical reasons, but may come for all kinds of other reasons? You may have people saying something like, I don't want to go through labor pain, or you may have people saying, I don't want to spoil my figure. How do you actually separate the frivolous from the scientific need, which Dr. Rao points out?
Right. Basically there is in the guidelines there is defined indications for surrogacy. For example, a person can't do it for lifestyle purpose because that will be very frivolous and it could damage the overall movement of surrogacy. Surrogacy can be done only when the couple can't bear the child. If the woman has an absent uterus, many of the women have cancer of the cervix and they have hysterectomies when they are young. There are other people who have they by birth they have an absent uterus, or there are many people who have tuberculosis in our country, people who have medical disorders in our country. For example, just now I have done a patient of heart lung transplant, there where she cannot bear the child, so we took out the eggs and made the embryos and put them in a surrogate. So these are specific indications. Or recurrent IVF failure. For example, in Aamir Khan's case, she had recurrent failures, miscarriage, and that's why she went for surrogacy. So a definitive medical indication is a given, and it is understood that we will not do it for lifestyle purpose. The other point I would like to make is that because unfortunately till now a lot of focus in surrogacy has been given to the foreign tourism. Actually the population is our Indian population. We are 1.2 billion people, and this law which is being formulated is mainly for Indian couples. And in my practice, for example, nearly 80% of the people are from India, and that is the foreigners are utilizing the good relaxed laws which are there here. There's more economical, but you have to understand that the main focus is for India. India is 1.2 billion population. It's 1/6 of world's population, and the law is meant only for
you're
our
saying it's
people.
it's not about baby shopping or baby tourism, as it were. Let me just go across now to our correspondent in Mumbai, Saurabh Gupta, who has with him a young Israeli man, a single father who opted for surrogacy in India. Let's just hear what Saurabh has to say with Mr. Eli.
Sonia, Omar Ali joins me now. He's just had a baby through a surrogate mother here in India. This is not his first experience though through having a baby through a surrogate mother. He's had another baby through a surrogate mother in Thailand, but this is his first experience in India. And joining me now is Omar Ali. Umar, you've had a baby in Thailand and this time you've had a baby in India through a surrogate mother. What has your experience been like?
I like the way it works in India. I think the agency, they work very professional. They take care for the surrogate mother. They are human and they know how to do all the process from the beginning until the end. And this is the reason that I choose to do it in India.
Umar, also often there is an allegation that the surrogate mother doesn't get what she deserves, that she is exploited in certain cases. What do you have to say about that?
I don't think so. I think that the agency take care for the surrogate mother. They give her all what she need. They just keep her and give her the most medical that she need in all the 9 months. And I don't think that there is any problem with the surrogate mother.
Well, sort of there speaking to that Israeli father. Dr. Rao, final comments from you. The debate, however, continues with many people who feel morally opposed to surrogacy, making the point that in India, a population of 1.2 billion, as Dr. Pai pointed out, there are so many abandoned children. Why don't doctors urge couples to go for adoption rather than surrogacy or every new technology that science can come up with?
Sonia, I just want to put a point over here. You talk about adoption. You know how difficult it is to have a baby adopted, or to have a baby from adoption, because the process is so long. It takes about a year, 2 years. And if a woman already has her ovaries and she's able to, get her eggs out, and her husband has his sperms, why should a person who comes to us want to go for adoption? If they want to go, I'm sure I'm very happy about it. They should go. But the moment a person in the clinics like myself tell this couple, why don't you go for adoption? The first thing they tell me is, look, we've come here not to come to an adoption agency. We've come here to have a baby of our own. And I think the right to procreate is a fundamental right. And I feel that if they want to have a baby of their own, they should be. And when you talk about 1.2 billion population, you're talking about, a totally different thing. Here is a couple that doesn't have a child.
So you're saying,
and they're wanting one child. What is wrong in that?
So you're saying
and it's a highly individual problem.
Sure. So you're
it's not
making
fair.
the point
And I also want to say, here, Sonia, that infertility should be included in the insurance scheme, because I feel that infertility is not a disorder only, it's also a disease. It affects 10% of our population, and I think it's the single largest disease that we can have today. And that not being included in the insurance scheme is a shame. I think the government should look at it very favorably and look at it as soon as the guidelines come in, that insurance should cover infertility for all.
Right, Dr. Rao, Dr. Pai, thank you so much for joining me with your views on surrogacy tonight. As I said, that's another very controversial topic, but Amir Khan and Kiran Rao going public is something which seems to have changed many opinions. Thanks so much for joining me. I'm going to take a quick break now. We talk about, breakthroughs in fertility treatments, but let's